Liverpool Street Dental Clinic. My name is Christian Mel. In the following small video, we would like to show you which kinds of removable dentures exist and which we can use to re-establish your aesthetics and your function. We really thank you for your time and we hope that you enjoy the video. Thank you.
You can see here the initial situation of a patient wearing a full denture in the upper jaw and a cobalt chromium denture on 4 residual teeth in the lower jaw. And of course the patient was not very happy with the look and the feel of her teeth, and she wanted to have them replaced with teeth she would like to wear, enable her to eat and look good. So the first thing we do is always taking an absolutely precise impression, here an impression of the upper jaw. Then take the bite, that means let the technician see how the patient has a relation between the upper jaw and lower jaw. And of course you can see the small cracks in that splint in the upper jaw indicating the way and the width how the patient smiles, so that the technician can choose the right teeth and produce a proper set which matches the patient's mouth. You can see here the relation of the jaw being taken from inside the mouth. So this is just resin splints with wax walls on top, which can be adjusted and painted onto, so to give the technician as many informations as possible. Then the first setup is coming from the technician on that resin splint, and you can see here that we have still some small corrections to be made. We use a black marker for that, so that the technician can exactly see how and what he should change. This is then the second set which the technician produced, and these teeth are already individualized. The patient wanted to have a little bit darker, a little bit more naturally looking teeth, that nobody could suspect she's wearing a denture in the upper jaw. So when the patient is happy with that, the denture goes back to the technician and can be finalized. In the lower jaw we placed 4 implants to support the existing teeth or to support the denture as well, that she has a safe and secure feeling for that. And this, what you see here in the picture, is a framework so that the lower denture does not crack. If you don't do that, the likelihood of cracking is very high. And you can see here the final situation of the full denture in the upper jaw and the full denture in the lower jaw supported by implants. Of course, the other ways as well how to produce denture. You can see here a full denture in the upper jaw and again a more temporary denture in the lower jaw, which the patient was not happy with. So this is a little bit a special situation. We produced 2 so-called adhesive attachments, here to be seen on both canines, and these attachments can wear and carry the denture. The advantage is that we don't need to completely prepare and remove a lot of the tooth structure. We can leave the tooth nearly as it is. And you can see here the denture placed on top of these canines. It is important that the teeth are not decayed in any way. You can see here another situation of teeth which have been severely destroyed by gum disease, by decay, by very invasive dentistry. And of course the patient asked us to give him a smile and teeth back. So what we did is we of course first removed the teeth which had to be removed, clean up the inflammations in the bone and the decay, prepared the teeth, and in that case we produced so-called telescopic crowns made of zirconium dioxide. Placed these telescopic crowns into the patient, and then these crowns, they carry a denture. You can see here the position of the crowns again, taken with an impression, and you can see here the metal framework carrying the teeth already made in wax so that we can check the position and the bite in the patient and can still change it. And this is then, after we've done that check, the final situation. And you can see the golden teeth here, they fit on top of the telescopic crowns which are in the mouth of the patient. The framework is very important as it stops the denture from breaking. You can see one tooth has fallen out. This lady had an accident, so if you ever lose a tooth with such a situation, it is never a problem. The denture can always be adjusted.